Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
As the man said, this show was designed to provide you with information from the professionals, absolutely free of charge. This is Health Talk, brought to you by Mon General on WAJR. Jim Stallings along with my co-host, Kay Murray. Good morning, Kay.
Good morning, James.
And welcome back to the studio, Dr. Todd Tallman. Good morning, Dr.
Thank you
Tallman.
very much. Nice to be here.
October is Breast Cancer Awareness Month, and I think that each and every year we are becoming more and more aware, specifically with some of the efforts by the NFL, college players wearing pink to bring about awareness for Breast Cancer Awareness Month. And so the month of October, let's talk about some statistics. First of all, the awareness seems to be increasing. Are we diagnosing more women with breast cancer? And is that a good thing or a bad thing?
Well, I guess there's a couple different ways you can look at that. I think we're diagnosing more women earlier than we ever have. And I think you're right. I think the awareness is there. It seems like back when I started my career, someone was diagnosed with breast cancer. Sometimes they'd hide their diagnosis, and they didn't want to talk about it. And nowadays, I think women know that other women have breast cancer. They're more than happy to share their experiences. I think it's nice because the support system is much improved over what it was years ago. You talked about the NFL. There's breast cancer walks. There's breast cancer runs. There's breast cancer programs. There's support groups like the one through the university. I think it's just the awareness is definitely there. I think that definitely has helped the situation.
What's the main point of education? Early detection?
I think so. Yeah, I think the most important thing is not to be afraid of your breasts. You have to have them checked. You have to check them yourselves. You have to get mammograms. I think that's been a point of debate recently, but I still would tell women, keep getting your mammograms for now. Start at 40, get them yearly. Have your physician check you at least once a year. But again, don't be afraid to check your own breasts. I hear women say, well, I can't really tell what I'm feeling. And that's okay, because almost always you're feeling nothing. But you have to know your own breasts. If something comes up, typically you will know it. Something will feel different. So don't be afraid to do self-breast exams.
We had a buddy system at one point with Mon General, and where a friend would call a friend and say, maybe every 2 months or something, have you been conscientious? Have you been checking your breast? And you kind of remind each other. And I think also that brought up the form of talking about it and the education of all of it. And it seemed to be very successful. So I think awareness is so important.
Yeah, and I see some women who, they make their yearly mammogram a social event as well. They may get a group of 3 or 4 women to schedule it on the same day. They go out to breakfast. They go get their mammograms. I think that's a nice idea too. Hopefully making a less stressful situation and just a more routine situation.
When you talk about less stressful, I think also women knowing now what we know today, you've come a long way in survival and women being treated for breast cancer.
Mm-hmm. Yeah, and we talked about earlier detection. Back in, I say in the old days, I'm only about 46, but back in the old days.
Don't look at me when you say that.
You're a very well-preserved
Okay,
46.
You are fine, yeah. But back in the old days, we'd not infrequently see advanced breast cancers come into the clinic, and we almost never see that anymore. And that's a tough situation. The treatment course is much more difficult with that. Most of the women have friends who have gone through breast cancer treatments. A lot of times you can keep your breast, and the survival is so much improved. If you can detect this at an earlier stage, it just makes everything easier for the woman involved if we pick it up early.
Dr. Tallman, you are so correct, because I can remember going back when I was 20 and 30, something you never talked about.
Yeah.
You never thought about it. Really, you didn't. It was there, but it's something I can't remember 20 and 30 ever asking anybody about breast cancer. Of course, very lucky that nobody in my family had breast cancer, and that is a big factor, isn't it?
Yeah, genetics certainly plays a role. If you have a significant family history, especially if you have someone in your family that was diagnosed at a relatively early age, say younger than 45, 40 years old, all the more reason to be very careful. Even start your exams earlier. We talk about breast exams. Women start seeing their gynecologist 18 to 20 years old. And at least every 3 years, most gynecologists will do a breast exam. But if not, remind them that it's probably time to check. And they'll be more than happy to do that for you. But again, if you have a family history, you need to start your exams earlier and be persistent getting checked at least once a year.
And your doctor's going to know that about your
Correct.
family history.
And if they don't ask or it's not brought up, you can mention it, make sure it's in your chart so that they will be aware.
Well, there's always research going on in breast cancer, and I'm sure always money being raised by the American Cancer Society. And when I think about October and the NFL players wearing the pink, I'm wondering, are they saying, I support additional money for research or raising money or early detection? I guess all of those things when we're talking about awareness. But, I mean, is there still more to learn? Because with early detection, many women now survive having breast cancer. Is there always more to learn as far as the research end goes?
Well, until we have a cure. I mean, there's always something to learn.
So we really don't know what causes it. There are risk factors.
Not exactly. Yeah, there are certain genetic disorders. One of the more common ones is a BRCA gene that's defective. Now, that's not all breast cancer. That's only about 10% of the breast cancers. There's still 90% out of there that we don't know why they start. Some genetic testing is done in certain patients with extremely high risks, not on everybody. But if that gene is there, sometimes we do even more aggressive therapies. I think what you're talking about, though, as far as the pink ribbons discussion, NFL circles and elsewhere, the awareness is huge. And we talked about lack of anxiety and discussion amongst your friends and things like that. I think that helps. I think it goes a long way for that.
I guess we're bringing it out in the open, whereas before maybe we didn't talk about it. People kept it within, behind closed doors. That's very private and personal.
Right.
And with the pink ribbon campaign in the NFL, maybe they're promoting awareness, and it's okay, talk about it, remind each other through a buddy system to, check yourself, get checked, and all of that.
Correct.
So we've come a long way. 304-296-0041. October is Breast Cancer Awareness Month. We'll continue the conversation in just a moment with Dr. Todd Tallman here on Health Talk, brought to you by Mon General on WAJR.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
Dr. Todd Tallman is our guest this morning on Health Talk, brought to you by Mon General, and it's Breast Cancer Awareness, the topic today, and it's also Breast Cancer Awareness Month in the month of October.
Yeah, I want to talk about the steps, if we could, and let's say that I found a lump, and I think, maybe it's just going to go away on its own. I'm a little scared. Do we really want to know the truth? Well, you absolutely do. You must, because early detection is the number one key here. So let's say we found a lump. What do we do at that point, Dr. Tallman?
Yeah, I think the biggest thing is you can't ignore it. You don't want to say it's nothing and I'm not going to pay any attention to it.
And I think you're scared too. You just think maybe it'll go away.
Yeah, and you mentioned, can I watch it? Well, I think it's reasonable to watch it for a couple weeks. Especially in younger women, because cysts and benign things are very common. They come, they go, they come, they go. But, if that persists for more than a couple weeks, then I think it's time to let either your family doctor know, your gynecologist know.
Is that where we start?
Typically so. And, if you've seen a surgeon before, that's always an option as well, especially someone who's had other breast issues in the past. There's multiple x-rays done. We mentioned mammograms previously. Ultrasounds are also done to help determine whether it's a benign appearing cyst or a nodule.
And most are.
Most are. That's correct. Sometimes if there's something suspicious, though, diagnosis needs to be made. That's come leaps and bounds. We talked about the old days. In the old days, you'd have to get a lump removed surgically. Mm-hmm. Nowadays, it's mostly a minimally invasive needle biopsy. We talk to patients, and they say it's not nearly as bad as going to the dentist. I apologize to all my dentist friends out there, but 90% of the time these biopsies will be benign. But what you don't want to do is ignore a lump, wait on it, let it turn into something worse than it has to be. You just come in and get it checked. Most of the time it'll be fine, and you go back to your routine
And you
screening.
find cancer, though. It is cancer, then what?
Typically with cancer, with early cancers like we've talked about, there's always options. initially with surgery. Studies had been done in the past. In the past, I think more women got mastectomies, removal of their breast. What the studies had shown is that's not absolutely necessary. A very personal choice, though. Some women are not comfortable keeping their breasts, and that's fine. Most women nowadays, though, decide to go with minimally invasive, where you just have the lump removed. We can now check a single lymph node or 2 lymph nodes under the arm at the same time. Woman gets to keep her breast. If you keep your breast, most times you'll have to have 6 weeks worth of radiation treatment. We joke it's kind of like going on the tanning bed for 6 weeks, once a day. But then typically after that, you're done. After surgery, depending on what we find, oftentimes there's additional treatments that are required. That's the medical side of breast cancer. People receive chemotherapy for advanced stages of breast cancer, and that's all prevention for the breast cancer coming back in the future. Sometimes that's something as simple as a hormone pill for 5 years. Sometimes it's more aggressive. You know, we've all had friends who have lost their hair with their chemotherapy. Usually it's about 6 months. It's rough, but you know, there's hoops we must jump through when we have this diagnosis.
You can survive it.
That get us to the other side where we are the survivors, and we've much decreased our risk for problems in the future. So the diagnosis comes, we accept we have the diagnosis, and we choose to proceed through the chores that are required of us to get to that other side. And you know, the support systems, all the awareness like we talked earlier, make that, I think, a little bit of an easier process than it used to be. Not easy, you know. It's like going out and running a distance race. You know, I'm not wanting to run 5-10 miles, but you know, if you get to the other side in good shape, then it's worth it.
Once you've removed the cancerous portion of the breast via lumpectomy, what are the chances of cancer redeveloping in that same breast and or on the other one?
The risks on the opposite side are fairly low. You know, low enough that we don't typically recommend having the other breast removed. The risk in the same breast is somewhat increased right there where the breast tumor was removed, but that's also pretty low. It's at somewhere between 1% and 3% a year. Of course, you're going to be getting checked frequently with mammograms, at least, maybe ultrasounds, sometimes even MRIs, depending on the patient. But most women do quite well, and it does not come back. That's the vast majority of women.
I know that when you have a mastectomy, I mean, you can find artificial breasts, so to speak, to fill yourself out again. But I'm wondering about a lumpectomy, if that leaves a misshapen breast.
Yeah, and that's one of the things a woman has to decide for herself when she's choosing which therapy. You know, women with smaller breasts, larger tumors, can distort the breast some. You know, I have a close family member that had early breast cancer, and she went through that exact situation, smaller breast, larger breast tumor, and had difficulty with the surgery afterwards. Sometimes women will choose to have the breast removed and have immediate reconstruction with our plastic surgeon colleagues, and that's also a good choice as well. Again, the type of surgery you get, you know, the women do equally well with the different types of surgeries. Boy, it's an awfully personal decision, and we give everybody the options, you know, the benefits and detriments, and help people through it as much as we can. But ultimately, they have to make their own decision, which sometimes I think that's the hardest thing they face, is deciding what they want to do.
Do you have counseling for that? Do you?
Yeah, we counsel them.
Do you?
Yeah. Typically, the family's there as well. Some of the support services like Reach for Recovery are also helpful in that situation as well. Other people that have breast cancer have gone through those difficult decisions will help them as well. But that seems to, again, sometimes you don't have a choice, you know.
Sure.
There's certain types of breast cancers or widespread breast cancers throughout the breast that make it so you really can't have breast conservation. But you know, with more choices comes some difficult choices.
Sure. You mentioned the mastectomy, and you can do the mastectomy and the reconstruction all in the same surgery?
In certain patients, that's correct. Yeah, and surgery takes a little bit longer. A little more pain than the typical mastectomy, but the benefit is that you have a breast when you wake up. Sometimes it's done with artificial implants. Sometimes it's done with abdominal tissues.
Really?
The tummy tuck, breast flap. They bring that up at the same time.
That would be the
reconstruct
choice
the
for me
breast.
right there, yeah.
No, we shouldn't joke about this, Kay. Come
Oh,
on.
come on now. You're the jokester,
All right, I'm just
not
kidding.
me.
Now, we will continue the conversation in just a moment. I think really we should emphasize early detection and prevention when we come back from the break. And you are listening to Health Talk on WHAR with Dr. Todd Tallman.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Dr. Todd Tallman, our guest on Health Talk, brought to you by Mon General Hospital. So October is Breast Cancer Awareness Month, and with the last 3 or so minutes that we have on this program, what's the most important message that you think you could get out to our listeners about awareness with breast cancer?
I think the most important thing is, just don't ignore the risks that are there, do your routine maintenance, your mammograms, your self-breast exams, which again, on your self-breast exams, if you feel any lumps, if you have any unusual skin changes that don't seem to want to heal up, thickened areas, a change in your self-breast exam, which, we want you doing monthly. If you have any of those things, let your caregiver know about it and have them check it. Get your mammograms regularly. Start at 40 and get them yearly. Be persistent in not letting anything go. Worst case scenario, if something does happen, we want to get it early, and that will keep you out of trouble.
Kay and I were going to ask, I bet, the same question.
Lifestyle.
Next. Yeah. What can we change about our lifestyle right away that could perhaps ward off cancer in the future?
Of the usual things, alcohol is the most strongly proven association. Smoking, they suspect probably not as strong as in some other cancers like lung cancer. Obesity, a problem here in West Virginia, seems to increase your risk. Those are the main ones, that we can affect, And it's all about keeping yourself healthy, and I think that certainly helps.
Is there any additional risk from hormone therapy?
The hormones that have progesterone in them seem to have some risk. When that's stopped, the risk seems to resolve after about 5 years. Again, the problems not taking them are obvious as well. Some people have severe symptoms and really almost have to be on them. But again, make sure that's something that you discuss with your doctor who's going to give you the medications for hormone replacement so that you're aware of the risks and the benefits, and you have to balance those against each other.
Is it true that breast cancer can reduce the risk? I'm sorry, breastfeeding can reduce the risk of getting breast cancer?
Yeah, there's some thoughts that that's the case. I have to say I'm not sure that that's one of the major ones, but any little thing helps.
Heard that, I wonder.
Yep.
If we wanted to learn more, or perhaps maybe something in the breast doesn't feel right, can we get a consultation with King, Burns, Tallman, Surgical Associate, and high school?
And high school.
By the way?
Absolutely. Yeah. We pride ourselves on getting people in quickly. Most insurances will allow you to see us, but if not, certainly your family practitioner will be able to get you an appointment to see us.
I meant to say Tallman High School, King and Burns.
That's
So you get the words in,
that's the way I always say it.
Yeah, that's right. High school's always first, I guess, but seniority has its privileges, I'm sure. So you're located at Suncrest Town Center. Really, you're above what's soon to be the Tilted Kilt, right?
I don't talk about that. My wife doesn't appreciate that concept.
What, it doesn't exist?
Come on, Jim, you're killing
We're
me.
talking about the building here.
Yeah, all right. But I see you're
above Kroger's. We'll
There
say.
you go.
above
That's it.
Kroger. That's your location. And what about if somebody wants to call for more information about breast cancer? What number should they call? Probably 598-2200, extension 139.
Certainly.
Oh,
Or
you're
just-
good, Jim.
or-
That's off the top of your head. There,
Yeah,
isn't it?
I have every guest number memorized over the past 25 years here, so I happen to know that at Tallman High School, King and Burns, it's 598-2200. Thank you, Dr. Tallman, for
Thank
coming
y'all
in
very
today.
much.